everyone, welcome back to another new edition of Windows and Current Affairs. And today, in this edition of Windows and Current Affairs, we're going to be taking a closer look over a group of youth that are targeting, of course, civil work and in particular serving society on many fronts and in many fields. Of course, focusing over health of citizens. We're going to be looking in detail over the mission of this group and this organization. Of course, it's an NGO, and of course, we're going to be also talking about the Youth Initiative for Mental Health and Psychosocial Support. What exactly is that particular NGO doing with that very successful initiative, how far it has reached? We're very delighted to be having with us here Mr. Ahmed Gamal. He is ENSA co-founder. We're going to be talking in detail about ENSA and its targets and its principles, and a lot more elaboration from his part. Good evening, Mr. Gamal, and let's first talk to you about ENSA. If you could give us a definition of your NGO.
Sure. Thank you so much for inviting me, and good evening, everyone. Actually, before I'm speaking about ENSA, I would like to say something before I'm speaking, that I'm proud to be a nurse. This is just like a statement I would like to say it before my speech. ENSA is a non-governmental organization led by youth for improving nursing profession in Egypt and health sector in general. And ENSA is the abbreviation of Egyptian Nursing Student and Alumni Association. It's a non-governmental organization. We started this volunteering activities since we are students, but now we are improving this work and make it more organizing through like under umbrella of NGO law in Egypt. And our mission to improve nursing profession in general, but we are focusing also on something named SDH, the social determinants of health. There is no any improvement of health or nursing profession or medicine or pharmacy without the concept of social determinants of health. For example, this like Sustainable Development Goals 2030, Egypt Vision 2030, all of this like intersectoral work together. So in ENSA, we are focusing on these volunteering activities to change the concepts and the point of view of the society toward nursing profession specifically through doing some active activities like the health needs of the population in Egypt in volunteering work. This is just in general, yeah.
So ENSA is, and as far as we can take it from you, is an NGO that is focusing or targeting over serving society on many fronts.
Yeah.
Could it be health issues or other issues or social issues, but mainly health because they are nurses. And of course upgrading the status of nursing in Egypt and also other places all over the world, since you are universal. It's not only focusing over Egypt.
Right. You know, this nursing profession represents more than 50 to 60% of the healthcare profession in general, the healthcare sector in general. So it's a huge human resources in health. So if you invest more in nursing profession, if you invest if you improve the nursing profession, it's absolutely will reflect on improving the health profession in general, especially this UHC, Universal Health Coverage law in Egypt, to improve the health for all in Egypt. So nursing is one of the active player in this. So this is one of the focus issues we are working on to upgrade, as you mentioned, nursing practice. So this is we are working on improving the skills, nursing skills, like technical skills at hospitals, and also admin skills, leadership skills, and even beyond the hospitals and the healthcare settings. It's the community. As I mentioned, this SDH is very important, the social determinants of health. It doesn't make sense if I improve or if I'm a nurse and focus on the patient at hospital. So what if he like discharged after going to home? How can he what are the resources of information or the source of information he might take for health? So we are making some health education projects, some patient education campaigns. Like for COVID-19, we trained many nurses and healthcare professionals, I think from 5,000 to 6,000, to train them to be trainers, to be health educators, to improve the awareness of population. There is no health without improving the concepts and the awareness of population in general. Yeah.
But mainly also looking at your NGO, it's important in a way that it is enforcing and empowering the role of nurses, which nobody might probably stop for 5 seconds and look over. It is the role of nurses is very important in the health sector, and 95% of a successful health file is nursing,
yes, definitely,
of course, because these are the facilities and services that are provided for the patients and for citizens in worldwide. I mean, in hospitals, probably private nurses or everything. So you are setting awareness amongst nurses and also empowering them.
Yes, definitely.
And boosting their ego and boosting their morale, so that they can give you their best.
Yeah.
In what way?
This is the key. Before I introduce myself and introduce the NGO I work in, I said that I'm proud to be a nurse. If each nurse in Egypt or even worldwide feel that proud of nursing profession, this is the key. This is the first action we need to take. If we said that improvement, investment, empowerment, if you need empowerment to be a competent nurse, we have to focus on 3 points: knowledge, skills, and attitude. So we have to provide nurses more knowledge, more training courses, more workshops to improve the knowledge level, to increase the knowledge level. We need something like renew the license. If you take, after graduation, you take a license to practice your role, we need to renew it like every 2 years, every 4 years, and depends on like CPD, this continuous professional development points. If you attend some conference, if you attend some workshops, so you will take some points to renew your, so if I renew your license, it's like driving license at your car at the street, you are renewing your driving license according to your competency in driving. So it's the same, but it's more important because you are driving the health concepts and the health sector in Egypt. The second point, the skills, the technical skills at hospitals. I mean the different level or the different specialties of nursing. We have medical, surgical, critical nursing. We have community nursing. We have obstetric nursing. All of these like specialty we have in Egypt. I think 9 to 10. Worldwide, we have 119 or 18 specialties in nursing. So this is one of the mission of us, that to improve the nursing skills at hospitals. The third part is the attitude, the behavior is very important issue to change it, to change the behavior, to change the concept that I feel proud to be a nurse. So I will do my best to improve this profession, to change the society point of view by skills, by actions as well. Yeah.
Right, but also, it's a surprise for us to know that nurses, they specialize also.
Yeah, definitely, yeah.
So could I be joined in as a nurse and I can do that, I can work on some sector and I can't work, I have to get trained to work on another sector? I mean, like...
currently we have like general nurses in Egypt. This is one of our passion, this is one of our goals, strategic goals, to make some specialties. And if you have a specialty, you will do your best, you will take some knowledge, skills, you will attend, you will read more like books, references, you will attend some conferences on this specialty, so you will be a competent, you will do your role like in some, for example, like intensive care unit or in medical surgical or emergency room. So I'm specialized nurse in emergency. So whatever the case I will receive or a patient, so I'm a competent nurse to do my job here in this emergency room. So this is the specialty we need, and we are doing some actions and some training to spread the concept. And we have some meetings, workshop with the policymaker, with the decision maker to convince them to invest more in nursing specialties as well.
Who initiated that NGO? Whose idea was it? It's
a long story, but shortly in 2009, We were a group of young nurses. Well, actually, we were students in 10 to 11 universities, and we had some like passion to work together under the supervision of the academic staff in the universities to do something like different about our role as a student. I'm a nursing student. Yes, I'm a student, but I need to improve my profession. So how can we do this? We had many conversations with our professors with and the students in other universities, and then we decided to work together in a volunteering way. This 2009, 2020 up to 2021, so it's 11 years. And then like eventually we registered this as a non-governmental organization to work with the graduated nurses, not only the students. This is like a step by step. This is the passion, started with a small like spark, and then it's increasingly step by step.
And until the time you've reached to get engaged in many initiatives that we are going to talk about later on, but right now we're going to go to a short break, and we'll see the speech, the official speech, ICN official speech that you gave in front of one of the World Health Assembly 72, right?
Yeah.
Let's go.
Sure.
Of physical rehabilitation, I have a pleasure in giving the floor to the representative of the International Council of Nurses.
Thank you for the opportunity to speak on behalf of the International Council of Nurses and over 20 million nurses worldwide. ICN and the nursing profession believe that strengthening primary health care is the most effective approach to ensuring universal health coverage. Nurses are the principal group of the healthcare workers providing PHC across different settings as care providers, educators, coordinators, and advocates. The scope within these roles continues to evolve as the health needs of individuals and communities change. ICN urges governments to remove barriers that impede nurses from working to their full scope of practice by optimizing the contribution of the largest group of healthcare providers and the health workforce. Nurses are vital to improve access within PHC, reducing health inequalities, applying people-centered approach, and managing the holistic needs of individuals, families, and communities. Nurses should be supported through policy and legislation to prevent, detect, and manage common conditions encountered in PHC settings. We strongly believe that effective and safe delivery of comprehensive PHC services is dependent on the strength, capacity, and capability of the health workforce. We call on governments to invest in quality education, recruitment and retention strategies, and assurance of decent work and fair pay. ICN is committed to working with all stakeholders and WHO to transform the PHC vision into actions. Thank you very much.
Well, welcome back, and we're still on talking about that particular initiative that we have been discussing, and we have seen the official speak that was given at the WHO Assembly. That was 72, number 72. We were talking about your engagement in several initiatives, very important initiatives, and we have seen your speech and the important stops that you have made. If you like to elaborate over your important speech that you gave at this forum, and how you impressed other people with that particular speech, what were you focusing over? What were your targets back then?
This official speech in the World Health Assembly 72 in 2019 in Geneva. This is the World Health Assembly, is the biggest forum of all health ministers worldwide combined together to discuss how can they improve the health generally in the world. At this particular event, and we did our best to engage, to speech, to reflect the important role of young nurses, not only in Egypt, but worldwide. After after 9 or 10 years of volunteering activities, we tried to show that this is our rule, this is our passion toward nursing profession to improve it. This particular speech regarding the universal health coverage. Universal health coverage, this very important concept to improve the health system in each country, especially here in Egypt. So this concept, the nursing rule, is very important to be engaged, to be full engaged in improving this universal health coverage concept. Our role as a nurse is not only to giving some medications to the patient as well. No, this is maybe one rule of 10 rules we need to improve. One of them like leadership, leading the health system in general. So in this particular event, we did our best to say that, and we believe in that young nurses should take the lead now, not only in the future. So it's very important. And really, it was like, you know, this a big gathering, all the health policies. We learned more in this event to be more competent in leading health and have this concept in general. Yeah.
You said a very important note, which is leading health policies gathered in one big forum that you can gain a lot of experiences. Talk to me about the different experiences that you have gained, I mean, from each country. How, when you assess the different experiences, what successful health experience do you think is fit for Egypt to be following?
Yeah, definitely. Thank you for this important question, because it doesn't make sense if you travel abroad and you have some experience and not transfer it to Egypt and to your country. So one of this experience after we did it, this like every country or each country has a national council for nurses to improve, to regulate the profession. So once we came back from this event, we tried to make like a model, like a simulation model for the young nurses. Just imagine if you have this national council for nurses, what would you say? What are the things, the priorities you have to think about it? So we tried in this simulation model, to transfer the young nurses from to be a part of the problem to be a part of the solution. So this, unfortunately, we didn't have National Council for Nurses in Egypt up till now, but we need to train the students and the young nurses. What if you are the president of this National Council of Nurses? What are the highest priority or the decisions?
Exactly.
What is the first decision you will take? So it's a different perspective, it's a different concept, it's a different way of thinking. So just complain that there is no enough equipment, there is no enough training. So what if you are the responsible one? What if you are the decision maker in this national council? So this is one of the really of the amazing experience we transferred after this event. Another thing regarding the mental health and psychosocial support as well. We saw that the mental health, that no health without mental health. And this is one of the concepts we learned from this event as well.
Very, very good point. Let us talk about the initiative that you initiated or you are working on right now, which is for mental health and psychosocial support. What exactly, how did that idea scratch to you, and what exactly are you focusing over when you started to launch that particular initiative?
Yeah. Mental health and psychosocial support, one of the crucial points and issues we need to focus and we need to enhance. As I mentioned before, there is no health without mental health. If you have some sore throats, if you have some abdominal pain, you will go to the hospital and you will say that I have abdominal pain. What if you have a depression? What if you have a low mood? What if you have sleeplessness? You can't sleep for 1 week. Would you go to the psychiatric hospital or mental health hospital and said that I need help? I think it's not easy because of stigma, of discrimination, of mental health and psychiatry in general. This is one of the key elements and the goals we are working on, to spread the awareness of mental health and psychosocial support in the community. Especially in COVID-19, during this initiative, we found that many nurses, they are overstressed You know, if you have stress because of many issues of COVID-19, especially for health professions, nurses and others, after over stress, you can reach to burnout. This burnout is something like a stage of psychological state.
And this is going to affect the way you behave.
Absolutely, yes. Yeah, because again, if you provide some mental health and psychosocial support for nurses, for physicians, for pharmacists, for the healthcare team, it will reflect on the patient as well. So there is no health without mental health. This for the health professions. For the public, we are trying to make these initiatives and awareness campaigns to say that it's okay not to be okay. If you feel that I have depression, low mood, anxiety, anxious, I can't control my anger, all of these mental health issues, and we need to be aware that I need to go to like a psychiatrist or a mental health hospital or mental health clinic, and don't feel like shame or discrimination that this one have like crazy person. It's not a crazy, it's a disease like abdominal pain. Yeah. Yeah.
So you're focusing nurses, you're focusing doctors in a way,
And the
on the other
population.
hand is the public.
Yeah, yeah.
How exactly have you been performing during that initiative? What type of services, what type of lectures or awareness campaigns or things? I mean, how did it go?
Yeah.
How did it work?
Great. So for nurses and the healthcare professionals,
You were touring governorates?
sorry?
You were touring the governorates?
Yeah, definitely. We have some local points or focal points in some governorates. So we are doing this training activities, especially in COVID-19 pandemic. Sorry. Last year we did more online teaching and online campaigns. And some activities in the local and focal points in some governorates. For example, in Upper Egypt, and for other governorates. So the main focus on two groups. The first group, the healthcare professionals, to spread the awareness that it's okay not to be okay, because after too much stress, sorry, after too much stress, especially during COVID-19, they need access or easy accessibility to mental health and psychosocial support. Even the health professionals themselves, they need awareness. They need to something like awareness about the mental health and how can you take care about yourself, I mean, in mentally. Yeah. And the other way, this population, we're trying to fight against the stigma of mental health and psychiatry. When we speak to a family, when we make some mental health campaigns on field or face-to-face in the street, and we speak to someone, did you feel like a low mood or depression before? And you will. I found some people look like yes, but I feel that if I say this or verbalize that, they will say like I'm crazy. So I will not say. I will not verbalize that. And we need, and we made already some like questionnaires, and we found really some like dramatic answers that we need to make it easy accessibility for mental health and psychosocial support. This is one of the basics needs. And again, there is no health without mental health. Yeah.
So how many type of sessions have you performed or worked out during that initiative?
Yeah, we organized many sessions for according to the profession, according to the type, according to the level. So we have like basic level and advanced level. The basic level, that we just spread the awareness for the population. This is the mental health. This is the main common features or symptoms. If you have this, for example, if you can't sleep for like 7 days, this is a sleeplessness, and this is one sign of depression. If you have low mood, if you dislike to speak to anyone, if you prefer to stay alone, all of these features we teach the people and make this during the campaigns through some like brochures, pamphlets, flyers, online training, face-to-face training, and one-to-one conversations. So this, we are trying to spread these symptoms. If you have these symptoms, you have to go to or call this number, or go to access the nearest psychology or psychology clinic or mental health psychiatry hospital. So at least they have a concept that yes, if I have these symptoms or these features, I will go to mental health services. So it's in terms of referral. So if you found someone like an anxious patient, an anxiety, so we need to refer him or refer her to the next level of mental health services as well.
So you are working under the auspices of the Ministry of Health?
Yeah,
And
yeah.
other also
And World Health
organization.
Organization,
And World Health
UNICEF.
Organization.
Yeah,
How
yeah.
did that work? I mean, you address those people, or you are signing protocols maybe, so that you can be able to work out campaigns like that?
Yeah, yeah.
How is each side participating? Who is financing you? These are questions that some people would
Sure,
like to know when they
sure.
admire your job.
Sure. Firstly, we approached the National Population Council. This is like a part of Ministry of Health, and we made already a like official protocol to train nurses and to spread the awareness in the community and the healthcare professions in general. And this like the official protocol, we are working under this protocol. So, and UNICEF, World Health Organization, all of these organizations like support, technical support for training, for workshops, for trainers like TOT, all of these types of training. In terms of material, they secured by the National Population Council and the Ministry of Health, and all of this work like volunteering. Me and all of my colleagues in ENSA, we are volunteering. We have like a dream and believe that nurses can make some differences in health in general. Nurses should be empowered to take the lead in health. Just like a dream of why like the Minister of Health will be a nurse. And by the way, this happened in Sudan, this happened in Jordan, this happened in some countries around us. So this is like a dream. But if you stop breathing, you stop bleeding. If you want to lead, you have to read. So we need to read more. We need to network more. We need to work with the stakeholders like Ministry of Health, National Population Council, World Health Organization, UNICEF, and many other services and departments and like intersectoral departments. This is the way we need to speak up in an official way in Egypt.
How is the Ministry of Health, for example, helping you? I mean, is it only under the auspices, I mean, with only the slogan of the Ministry of Health, or they are participating in many other ways? You are giving hands in governmental hospitals or sometimes in some medical centers?
There's many
or
trainings.
clinics.
Yeah, especially the National Population Council, the National Population Council, this supporting us like training, workshops, TOT, training of trainers, materials, technical support. Really, they are very supportive to us as a non-governmental organization, because we believe that we are a part of Egypt Vision 2030 and a part of the Sustainable Development Goals 2030, because we believe in that. So we are taking some actions with the government, with the National Population Council and Ministry of Health, to do that in an official way and in organized way and effective way as well, to reach this awareness, reach to the population needs to according to the health needs of Egypt.
We're going to go to a short break and we'll come to continue with the Windows and Current Affairs and this very important topic, so stay with us. Welcome back, and we're still on with our prominent guest, Mr. Ahmed Gamal. He's ENSA co-founder. And Ahmed, we were talking about the different issues for the population. I mean, if we keep talking and talking and talking, many issues are involved, but mainly you are working on foundational issues with the National Council for Population.
Actually, when we work with the National Population Council, we saw that this the National Strategy for Population, we saw the population in different way, because we have vulnerable groups like women, like learning disability or like handicaps, and for childs, for pregnant women, many other types or many other categories of the community. This name the vulnerable groups, they are like
groups with priorities.
Yeah, they need more empowerment. They need more focus. As you see, the presidential focusing on the presidential initiatives for the handicaps and learning disability. This is very important. This is one of the categories of the community, women empowerment. And by the way, nursing profession, we have, I think, I don't have exact percentage, but
I was
think
going to
like
jump
80
into
to
that
90%.
also. I was going to come over to
Yeah.
that. The noticeable percentage, let us give it that term, noticeable. We're not going to really give an exact number, but the noticeable noticeable percentage of nurses are women, are feminine.
Yeah.
So nobody didn't even stop to think that there are male nurses and they're efficient, they're helpful, they're professional, they're dedicated. Why is that?
In terms of advocacy, there is some male nurses. So,
how are you going to handle that? What are you doing to?
Actually, it's not only in Egypt, in other countries, in that, and we found some like in global initiatives.
The typical image of a nurse is a woman.
Yeah, definitely. So this is some like historical issues in nursing, because the beginning of the profession was led by nurses, by female. So this Florence Nightingale, this is one of the founders of modern nursing. Some historical issues, and but we need to and not need, but we are working in changing this image that there is male nurses and they are competent. Yes, we have some like facing some discrimination, some bullying sometimes, and but we are working, and we are trying to spread the awareness for male nurses and change the concept that we can practice our role, we can approve that we can do that. In terms of the inequalities of numbers of nurses, for women nurses, they need more empowerment as a woman. As women, we have the National Women Council, I think. We need to, one of our main goals or strategic goals to liaise and communicate with Women National Council to empower the nurses as a female. They have many needs. Just imagine like a female or a woman working in nursing, or even like a physician or pharmacist, and she has like 3 or 4 kids. Maybe she's pregnant and she's working in the hospital and providing the health care for the patients. So she needs to be empowered in some way, in different way.
Like in what way? What exactly are you doing to be able to empower this type of or sector of nurses?
Yeah, definitely. It's a very important question, because nurses need to be empowered in their healthcare setting, in their work. For example, the accessibility of work for women is a very simple need for the ladies or the female that she has kids, to make like a small nursery in the hospital for the kids or for the small kids. What if I have like a child like 1 year or 2 years? So I can't let him alone at home because my husband is working, and this is the nature of our community. So what should I do? Can I take him to the work? It's not allowed to take some childs into it. So one of our like advocacy rule, to speak with the decision maker and policy makers to secure like a small place, prepared place in the hospital to be like a nursery, not only for nurses but for all female and ladies working in the healthcare settings. This is one type. Another thing, to the transportation accessibility, because sometimes she can't.
And the working hours also.
Yeah, definitely working hours. We are working 24/7, and it's not easy.
And the unsocial hours also are not capable. She wouldn't be capable to work at certain hours.
Yeah, definitely. So it's not easy to go like 10 p.m. and work up to like 6 or 7 a.m. So it's not easy. So we need like more accessibility for nurses, to not only nurses, for female healthcare professionals in general. Like as I mentioned, like a physician, a female physician, female pharmacist, and because they are working 24/7. So we need to invest more in this topic. Another thing regarding the social work, or the social determinants, or the social aspects of nurses, and we need to be empowered regarding the issues of women health in general. We are providing health for people, so what about our health or what about the health of women, and specifically for women? We need it need to be more addressed and to be cared for women, especially for women in healthcare sector.
Also, you train and you give lectures to people with special needs and to empower them. Exactly. Tell us what exactly do you do?
The first thing, before we are speaking about these people, that the terms and the concepts, we need to change the words we are calling them. For example, that before they mentioned like handicap, now they have some other concepts like learning disability. They have some issues and difficulties to learn. This is the first action we need to do, to change the concept, the attitude and behavior toward them. Another thing we need to do, to consider them as a part of the community. This is very
Integration.
important. Yes, it's very important to integrate them, to feel that this like a harmony. They are a part of this community. Another thing, we are, especially during COVID-19, we had some plans to make this awareness of COVID-19 for the deaf, they can't hear, or the blind persons, they cannot speak. And we already did some material, some videos for deaf person that they can't hear. So we need like this signal language. How to protect yourself from COVID-19. This is one of the vulnerable groups and they need more support. We are nurses and we are care about these persons and about this category because they need more help, they need more support, they need more in terms of health, they need to be empowered in health. They need to be engaged in terms of patient-centered care, and this is a new trend of health. How can we engage the person or the patient in his treating plan? How can we communicate? How many physicians or nurses or pharmacists are competent in communicate with deaf person? How many healthcare professionals has the ability to use this signal language? How can I say like this is your medication and you have to take it before eating like 30 minutes or something like that? So at least we need like one person in each hospital or each healthcare facility to facilitate that. So many issues, we have many plans to support them. We have like the government support for them. And as a non-government organization, we are working to support them in our sector, in health sector, to be more empowered in health.
On that very important note, we're going to be ending it here. Mr. Ahmed Gamal, you're an ANSA co-founder. Thank you very much for coming. All the best to you.
Thank you. Most welcome. Thank you
for
so much.
coming.
Good night.
And I guess this brings us to the end of this edition of Windows and Current Affairs. Many thanks to all of you. Until we see you again next week, that's a goodbye.